Recording in progress.
Right. Well, welcome everyone. My name is Alice Long, and I'm. Can you hear me at the back? Not really. Not really. Okay, a bit closer. I used to teach in a university, and they could never hear me, so I had to go right up to the mic. So can you hear me now? Yeah. Brilliant. Okay. If you can't hear me, just put your hand up, and I'll speak a bit louder. So my name is Alice Long, apprenticeship lead for NCL Training Hub. That probably doesn't mean too much to you, does it? Does anyone know what a training hub is? No? So a training hub is essentially primary care and social care, which is, you know what primary care is, it's GPs, yeah, social care is domiciliary care and care homes. So together that actually is primary care, and the training hub is the staff development, kind of like training. So if you worked in a hospital, you'd have a staff development department. In primary care, it's a training hub. So in case you're wondering what training hub is, that's what I am. So I'm the apprenticeship lead, and my role is to support people to go on apprenticeships. And that's what I do. So I know pretty much about apprenticeships, but quite a lot about apprenticeships. Whoops. So I just wanted to make sure, does everyone know what apprenticeships are? Does anyone not know what an apprenticeship is? And if you don't know, could you put your hand up? So does everyone here know what apprenticeship is? Does anyone want to tell me what they think an apprenticeship is? Be brave.
It's when you work alongside your studying, so it's a mix of the two.
Yeah, absolutely. So you're working, you're studying at the same time. So it's essentially a job. It's like any other job that you would do, but you are paid, but you're also doing a qualification. And that can be from level 2 right up to level 7, and level 7 is equivalent to masters. It's unusual to go into your first job as an apprenticeship at the higher levels, but there are some degree apprenticeships that you can go into as an apprenticeship. I'm assuming you wouldn't know how to apply for an apprenticeship. That's why I'm here, so I'll tell you that. So essentially, you need to decide, where do you want to work? What do you want to do? You can't just say, I'm going to do an apprenticeship. You've got to know what area you want to do your apprenticeship in. If it is in care, so I'm not even using my slides.
Do you want me to move through this?
That's okay. If it's in care, you would want to look on NHS jobs. So NHS jobs, that's where all the jobs in the whole of the country are for all the jobs. So you would need to narrow it down, obviously, because you're talking thousands of jobs. So you would put in the search apprenticeships, and you put in where you live, that kind of thing. And that's the same for any job, for any apprenticeship. If you wanted to work for BT or anywhere, any company, you would look on their website and look for that apprenticeship job. Okay, so you'd think if you wanted to do an apprenticeship, you'd go to the university, you'd go to a college or a training company. You wouldn't. You get the job, and the apprenticeship is part of that job. That makes sense? Yeah. Okay, so I probably should look at the slides. So I'm just going to talk a little bit about primary care, as I already have. So there's primary care, there's secondary care. Obviously, I'm from the NHS, and there's tertiary care. So primary care, as I said earlier, that's your GPs, that's your social care, your care homes, all those amazing care homes that have done so well during COVID. And it's also domiciliary care. So that's people that choose to be cared for in their own homes, and professionals will go into their own homes and care for them. So that's primary care. You've then got secondary care, and that's basically the acute hospitals, so the large hospitals, Royal Free, Middlesex, UCLH, those kind of things. And then tertiary, may not have heard of that, that's the specialists. So you might get referred to a hospital, they then might refer you to another specialist within that. So just a little bit of information for the next one. Lots and lots of change going on in primary care, lots of changes, and there are lots of new opportunities. Keep going, keep going. I'm not going to do this. So lots of jobs. Yeah, people think, oh, I want to work in the NHS, be a nurse or a doctor. There's so many things you can do. There are 350 jobs in the NHS that you can do, which is quite a lot. Okay, so allied health professional. So that's the occupational therapist. So they're people that help people that have been in hospital or had an injury to come home, and they might put adaptations in so that they can live at home. Physiotherapists, dietitians, all sorts of things. Ambulance service, that's a really good way to do it. In fact, if you want to work for the ambulance service, you have to do it as an apprenticeship. That's all they do now. Dental team, I won't talk any more about that because that's going to be done later. Doctors, estates and facilities. Hospitals need to be looked after. They need electricians. They need people to build hospitals. So, you know, don't just think care. Health information, so data analysis, certainly in primary care, that's a really growing area where due to COVID and also in hospitals, we've had to adapt. You know, patients can't come to the centres anymore. So we have to make sure that we communicate with patients in a better way, and that will continue this way. That now the video conferencing and that kind of consultations that will carry on because people prefer it. My mother is in her 80s and she got quite annoyed. She had to go to the hospital an appointment about something or other, and that could all have been done on the phone. You know, oh, why did I have to go in? He didn't look at me. He didn't examine me or anything. And my mum's in her 80s, and you know, she preferred to have a phone call than go in. Management, obviously, lots of managers in the NHS. A medical associate, professions, physician associates. That's another good apprenticeship. Midwifery, nursing, of course, pharmacy, the psychological, mental health, public health. And then, yeah, there's so much more. The wider care teams, administration support. There's an awful lot. So pretty much any job in the NHS you can do. Okay, so if you want to find out more about careers in the NHS, just put healthcare careers in NHS in Google and you will find this website really, really useful. Same thing about apprenticeships. If you want to do an apprenticeship and you want to find out, maybe you don't know what apprenticeship you want to do, again, just put apprenticeships in Google and it should take you to the Institute for Apprenticeships. And that's where the 900 standards for apprenticeships are held. And you can look up and see, and there's an apprenticeship in absolutely everything. I've already said that. Yeah. So if you are considering doing an apprenticeship, really important things that you need to start thinking about is getting your CV together. I know it seems early, but start thinking about your CV, thinking about that personal statement, and make sure you get your maths and English. Really, really important. Really, really important. I can't stress how important that is. With all apprenticeships, you have to have maths and English. It's a government requirement. For some of them, you have to do it beforehand. For some of them, you can do it alongside. But you've got the opportunity to get your maths and English now, so that if you do go on to do an apprenticeship, you don't have to have the hassle of doing your maths and English. So I can't stress how important that is. Any questions? Yeah.
When would you recommend taking an apprenticeship versus doing the university degree?
That's a difficult one to answer. I think it depends on yourself. My son went to university. He didn't consider an apprenticeship, and I think universities, it is very different now. When you do apprenticeship, it is very much work based, but you're not paid and you have a loan. So if you do an apprenticeship, it's completely free. You don't pay, and you're not only do you don't pay, you're paid. So I can't say what's, it's up to you as an individual. You might just think I want to be a student all the time, whereas if you do the apprenticeship, you are being employed, so you will be expected. You will obviously be working, but you will be given time to study as well. And it just kind of depends on that mentality, on your mentality. What do I want? Do I want to be a full student, be able to really focus on my studies, and have a big loan to pay off at the end, or do I want to work? And you'll still come out with the same qualification. That's the thing. Pretty much every qualification, as I said, level 2 right up to level 7 is available. Has that answered your question? I don't think that's.
May I add to that, Alice?
Yes.
So in terms, it comes down to the opportunity cost. What you've got to look at is, do you want to go to university and be a full-time student, just as Alice has said, or do you want to go to university? Do you want to work with a company that's going to take you through the whole experience of being a full-time employee? You'll be working in different levels, but you'll be doing your degree at the same time. So I've got many of the students, or many of my patients that we help, they'll do an apprenticeship at a law firm. So one of them is now training to be a lawyer. She's doing her law degree, and she's working with all the partners in every single department. But in that law firm, by the time she qualifies, finishing her apprenticeship, a student from a law degree will have a law degree. She will have experience with several international firms. She'll be working with all these partners. She's got her name out there. Everyone knows that. And she's got a law degree. That's the difference, right? Between an apprenticeship and a law degree. But you can't knock the two. Each one has its benefits. Each one has its positives. The person who got a law degree, they got life skills. I'm not saying that person who didn't go to apprentice didn't get life skills, but university offers a very different opportunity, right? The life skills you learn at the university are very different to what you get on an apprenticeship. So you've got to look, you've got to think of the opportunity cost. What do you want? And essentially, it's tailored to what your needs are. Question.
Bonus question. Can you do like an apprenticeship at university?
Yeah,
with a
that's
degree?
what I was going to say. Yeah, absolutely, you can. So, for example, if you wanted to do a nursing apprenticeship, you can only do that at a university. Right? But it's different. You wouldn't apply to the university to do a degree apprenticeship. You would apply to the hospital and see where it's very rare, to be honest, that you'll see nursing degree apprenticeships advertised. If that's the route that you want to do, you're better off applying to be a TNA, a trainee nurse associate. And I know if you want to come and talk to me, and I can tell you how you can do that. But essentially, you're applying to become a nurse associate. That's a 2-year course, and then it's easier to do the top up to become a nurse. So that's an easier way of doing it as an apprenticeship. But yes, you will be working with a university. You have to. It's only universities that can offer a degree. I mean, private companies can as well, but it's mainly universities. Yeah, so you kind of get best of both worlds. You're doing an apprenticeship and you're working with the university. They're the training provider, and you get your degree at the end. Yeah, physiotherapy, occupational therapy. There's all apprenticeships in those areas.
Okay.
Yeah.
Thank you, Alice.
Right, guys, my name is Anis. I'm one of the directors for Angle House. So I'm going to talk to you about careers in NHS, but focusing on dentistry. So I know you probably think dentistry is teeth and filling and drilling. It's not that anymore. Things have changed. It's a very corporate industry. It's very business focused. People probably thought of Invisalign. Anyone heard of Invisalign? Invisalign braces. So these are multi-billion-pound businesses that come in, and they're more like banks now. So essentially, you've got a dentistry being very corporate. It is healthcare focused, but it's much more than teeth now. So can I have next slide, please? So essentially, in the opportunities in dentistry, you have dental nursing, dental therapists, hygienists, dentists. Everyone knows dentists. Specialist dentists, which are like orthodontists, periodontists. Dental practice management, which has now become like a really big thing. Marketing, healthcare, economics, finance, corporate dentistry, dental technology, and digital dentistry. So it's very different, it's very dynamic now. Next slide. So essentially, I want to talk about this because everyone kept on asking about how do I become a dentist. Now, normally you go to university and you go to university to become a dentist. Now, that is a conventional route that a lot of people take, but the new big thing is dental nursing. I know people do dental nursing, they qualify as a specialist nurse, and then they do orthodontic therapy or hygiene and therapy. And these are essentially the same skill sets as dentists, but they don't do the whole treatment planning. Now, to become a dentist takes 5 years, to become an orthodontic therapist takes about 3 years, to become a hygiene therapist, same pathway under dental nursing, about 3 years, or 3 to 4 years, but you could do both of them through university. However, orthodontic therapy is only offered to dental nurses. It's not offered to anybody else. You have to be a dental nurse to do orthodontic therapy. And orthodontic therapy is exactly the same job as an orthodontist, but without the 15 years of studying and, you know, you don't do treatment planning, meaning that if you came along and said to me, I need a brace, we can't treatment plan for you. You have to have an orthodontist to work alongside, but you do exactly the same job as an orthodontist. The pay salaries for the dental nursing is about 32. Orthodontic therapists earn about 70,000. Same thing with hygienists and obviously dentists. They earn the top. They earn about 100,000. But essentially, this is the pathway of what NHS dentistry looks like, what apprenticeship schemes are, and with dental nursing, everything's changed because of apprenticeships. People are coming in to do dental nursing, and then the whole world opens up to them. I know a couple of young women who've done dental nursing, and now they've become business managers because they've done the business degree, but because they're a niche in their own industry, everybody runs after them and says, tell me about, you know, business management as a dental nurse within my field. So it's very dynamic. Yeah, next slide, please. So our opportunities at Angle House, what we're offering is 18 months. We're offering actual apprenticeships at the moment. So if you come and speak to us, we can give you some forms, you fill them in, a HR team will speak to you, you can be on an apprenticeship next month. Yeah. And we've got opposite positions in trainee dental nurses, 18-month contract, dental lab technicians, practice administration, and practice management. So we are basically offering apprenticeships. We are expanding as a company. So we are happy for all of you to come see us and have a conversation, and you just fill in the form. A HR team will contact you. You have an interview. Start with us as soon as possible. Next slide, please. That's the link. So if you pull out your phones, you can come take it on now, come see me. I'm at the desk and you can take it from there, sign up with us. And yeah, but in terms of dentistry, it's not what it used to be anymore. And I kid you not, the opportunities are vast, they're brilliant. And especially for dental nurses now, there's never been much more opportunity than ever before for dental nursing. And it's not just a career. You can start off as an apprentice earning, you know, 18 to 21,000. 3 years time, you'll be earning 70 grand as a therapist. And also government laws have changed, which means therapists can open their own practices. So now there's a group of young girls in Manchester who've opened their dental nurses who qualified as therapists, and they had this unique idea of doing nails with teeth. So they do hygiene work, they do their teeth, and they do the nails, and they've done it for weddings. So all the girls who get married up north, they come to this one practice. Really remarkable, really innovative, very entrepreneurial. But the idea is, look at that. That is entrepreneurial. That's business, and a group of nurses have done this. So dental nursing is the way forward. It's a brilliant career. Please do sign up. Next slide, please. Questions? Any questions? No? Must have done a good job. Go on, please.
You just do dentistry.
Yes, orthodontics. But with dentistry, what we do in Angle House is much more than that. So Alan here is my colleague.
Yeah, sure.
Alan is our tech guy. So he's basically he's our marketing manager. Like I said, dentistry's changed completely. He's a whiz kid at marketing. So he's now part of our marketing team. He leads all the marketing for the entire company. And this is social media and everything. Please.
Yeah, so I've recently joined the company. I've been at the company for about 3 months now. And I've never been in orthodontics before. I've kind of started my career in hospitality. So I had a really deep interest in Photoshop from a very young age. I'm 23 now, but I started learning Photoshop at age 11. And I finally got around to the end of kind of college, and I was trying to figure out what to do in my life. And so I started off in hospitality doing social media. And then I worked my way through and then did finance and did lots of like freelance work, and freelance is really tough. So doing anything on your own is like really tough. And so if you can find a place where you can develop your skills, I think that's the most important thing. And when I landed my role at Angle House, I didn't know anything about orthodontics. And then 6-7 weeks later, now I know pretty much everything. And I'm managing the communication for all 11 practices in across North London. And my first impressions of what orthodontics is and what the industry is just a bunch of really good people doing really good work, and making people smile and making them happy is like the greatest thing you can get into and do, because we all look at people's eyes and people's teeth when we speak to them. And if we can all work together to have amazing teeth and fix our problems and our crooked teeth and make them nice and straight and have a beautiful smile, then that's something we'll have for the rest of our life. So what orthodontics really is about is providing a service, a one-time service that someone can benefit for the rest of their life. And I know from experience from doing lots of freelance work, and I've done freelance work all around the world from clients all around the world. And what I learned from that is no matter what work I do for that client, it's how they feel at the end of it. And so if I do that work and I get a 5-star review and the client is happy, I know I've done a good job. And so imagine working for orthodontic and you not only get you not only get a review, but you change someone's smile forever. And the next time they smile and have a conversation with someone, they no longer feel self-conscious, and they no longer feel embarrassed about themselves, and they make other people smile because they are smiling. So, yeah.
As you can see, dentistry has changed. Yes, Apprenticeship, GCSEs, you get a couple of GCSE grades. Well, you need to get your English and maths, but for us, essentially, if you can, I think with dental nursing, it's a very different requirement. So you can have 4 GCSEs and you off from there. So it's not that much of an issue. However, it's about discipline, because dental nursing, like nursing, is all about discipline. It's a servant leadership role. What I mean by that is that you're serving the public. You're a public servant, and that requires discipline. It requires focus, and you have to be, dedicated, because you're providing healthcare. It's a caring industry. Any other questions?
Got time for just one more.
One more question? Any other questions? No? Okay. If you are interested, I cannot stress enough how important this change in dentistry is, because I've met young ladies who have done dental nursing and in a space of 3 years, done better than some people who've done a PhD. And it's because of the role that dental nursing offers in terms of the development, the experience, and more importantly, the need for now these therapy roles within dentistry. Dentistry moved. There's a lot of studies that have come out whereby dental nurses have been trained. There's been studies on dental nurses. It's remarkable when I read this, where they got dental nurses, they trained them up, and they gave them the same skill set as doctors. And the dental nurses outperformed the doctors that were in the field. And the reason being is because over the years, the dental nurses, they build that rapport. Nurses have this rapport with patients that doctors can't have. It's just something that happens. And because of that, these qualifications have turned out to be created better clinicians and provide a better service. That's it. 20 cents. Thank you.
Thank you very
Yes.
much. Thank you, everyone.
Stop. Yeah.